Hey, and welcome. In the high stakes world of medicine, every single decision matters. Having the right tool for the right job can literally be the difference between life and death. So today, we're going to open up the clinician's toolkit and get a handle on one of the most important concepts in treatment. Okay, picture this. You're right in the middle of a medical emergency. The clock is ticking, things are intense, you've got dozens of possible treatments, but there's almost always one that stands head and shoulders above the rest. So what is that number one go-to right answer? Well, that answer is what's called the drug of choice, or D.O.C for short. Now, this isn't just a good option, this is the gold standard. It's the therapy that tons of research and real-world practice has proven to be the most effective, safest, first-line treatment for a very specific problem. Think of it like a master key for one very specific lock. So, let's pop open the first drawer in our toolkit. This is where we keep the heavy hitters, the big guns for fighting some of the most dangerous infections on the planet. And our first challenge comes straight out of these clinical notes. How do you treat Falciparum Malaria in northern India? What this case immediately throws a spotlight on is a massive problem in modern medicine, and that's drug resistance. The drug of choice here is actually a combination, Artemether plus Lumefantrine. So why this specific combo? Well, it's absolutely crucial because, as the notes show, this strain of malaria has gotten smart. It's developed resistance to older drugs like sulfadoxine pyrimethamine. But context is everything. This D.O.C comes with some really important warnings. It's not for women in their first trimester of pregnancy and not for kids who weigh less than 5 kilograms. All right, let's switch gears to our next infectious threat. Now, this one isn't about treating an infection that's already raging. This is about preventing it from ever taking hold. We're talking about prophylaxis for cholera. So the go-to drug is tetracycline, and this is a perfect example of how the drug of choice isn't just about the what, it's also about the how much. Getting the dose right is critical, and as you can see, it changes a lot based on age. It's 500 milligrams for an adult, but that plummets all the way down to just 50 milligrams for a small child. It's a huge reminder that in medicine, one size definitely does not fit all. Okay, let's close that drawer and dive into the fast-paced world of the emergency room. This is where the right drug of choice has to work in minutes, not days. These are the real lifesavers. Here is a classic, and I mean classic, ER scenario. A patient comes in with an acute morphine overdose. This is a red alert, life-threatening situation where their breathing can just stop. There is absolutely no time to waste. And the answer is just so clean, so simple, and so unbelievably effective. The drug of choice is naloxone. It's a powerful antidote that basically kicks the morphine off the receptors in the brain, and it works fast. It can literally pull a patient back from the brink. It's the perfect example of a targeted, knockout punch kind of drug. All right, here's another poisoning case you might see roll into the ER, Ethylene Glycol Poisoning. This is the toxic stuff in antifreeze, and it becomes incredibly dangerous once the body starts breaking it down. The first-line drug of choice is Fomepizole. It works by blocking the enzyme that turns ethyl glycol into those super toxic byproducts. But, get this, the notes also list a really fascinating alternative. Ethanol. Yep. That's right, the same alcohol in beer and wine can be used as a medicine here. It basically competes with the antifreeze for that same enzyme, which stops the poison from forming. How wild is that? Okay, for our final section, we're going to shift gears from those fast-acting emergency drugs to the more nuanced world of managing specific, often chronic syndromes. Here, the drug of choice really depends on what you're trying to achieve long-term. So let's tackle a condition that needs real precision: panic. It's not just one thing, right? Treating it means knowing exactly what you're targeting. Are you trying to manage the long-term disorder, or are you trying to stop a terrifying, full-blown attack that's happening right now? And this is where the strategy just completely splits. For the long-term, day-in, day-out management of panic disorder, the drug of choice is an SSRI. This is all about prevention and stability. But for rescuing someone from an acute panic attack in the moment, you need something that works fast. That's when you turn to benzodiazepines. Two very different goals, two very different tools from the toolkit. Next up, sickle cell disease. One of the biggest challenges for patients is dealing with these incredibly painful episodes called vaso-occlusive crises. They're just awful. So the big question is, how do you stop them from happening in the first place? The drug of choice for the prevention of these crises is hydroxyurea. Now, to be clear, this isn't a painkiller you take when a crisis hits. This is a long-term therapy that actually reduces how often these debilitating events happen, and it can fundamentally change the course of the disease for so many patients. And our final case today is myasthenia gravis. It's an autoimmune disorder that causes some pretty significant muscle weakness. So the goal here is to manage those daily symptoms to help a person live a better, more normal life. And for that very specific goal, just treating the symptoms, the first-line drug of choice is pyridostigmine. It helps the nerves talk to the muscles a little better and improves muscle strength. A really clear-cut D.O.C. for a very specific target. So after digging through all these clinical notes, what are the big ideas we should pack into our own mental toolkit? What really matters here? Well, the biggest takeaway has got to be that knowing the drug of choice is all about precision. It's not enough to know a drug. You have to know the exact condition, the patient in front of you, and what you're actually trying to accomplish. Whether you're fighting a drug-resistant infection, reversing a deadly overdose, or managing a chronic condition, it all comes down to picking the right drug for the right situation. In medicine, context is absolutely key. And that kind of leads us to a final thought, doesn't it? Every drug of choice we talked about today was once a groundbreaking discovery. It makes you wonder, as science keeps pushing forward, and as we face new challenges like even more drug resistance, what are the life-saving drugs of choice that are just over the horizon? What will tomorrow's toolkit look like?